Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/staysafe for up-to-date information and tips.
So due to our closures of all of our congregate dining centers and senior centers because of the COVID-19 pandemic, we have 26 different locations that we're still providing meal services for, although today is one of our 10 grab-and-go locations. The grab-and-go locations were established at the locations where seniors live in our senior high-rises, senior apartment complexes, and for that we work with our food vendor and we're able to literally bring frozen meals to our seniors, and then we're delivering 14 frozen meals to our seniors every other week, so we make sure that they continue to receive the nutritional meal that they would have if they were still attending one of our congregate dining centers.
The meals are wonderful. To me, they're restaurant quality. There's a wonderful variety. It's quite enjoyable. We're used to coming downstairs, having lunch every day, and most of us have given up our cars, so we don't have a car. We don't have the bus to take us to the store, but it would be worse if we had to put together meals ourselves with what we have. To know that the county is taking good care of us and bringing these frozen meals to us, this is very much appreciated. The county takes care of the seniors, and we are eternally grateful. We're very grateful.
With this pandemic that we are all experiencing, often seniors are a forgotten population. So for our department to continue to stay connected to our seniors, it is crucial for their mental, spiritual, and emotional health. And also we are providing a nutritional value. We're making sure that they are still receiving a nutritional meal. And the feedback that we continue to receive from our seniors is, thank you, thank you, thank you. You are saving me from self-isolation and just going into a state of depression.
Hillsborough County has issued a safer at-home order to help prevent the further spread of COVID-19. This applies to all residents within Hillsborough County, including the cities of Plant City, Tampa, and Temple Terrace. The safer at-home order means all residents are directed to stay home as much as possible, 24 hours a day, 7 days a week. While the order is in place, you and your family can Get groceries, medicine, or other essentials. You can go outdoors to get some fresh air, enjoy recreation, and walk your dog, but it's important to continue practicing social distancing and stay 6 feet apart from others. You can support local businesses by ordering delivery or takeout. To promote the safety and well-being of all people, public health experts recommend that all large gatherings, including religious services, be conducted online or through other communication technology whenever possible until the threat of the COVID-19 coronavirus has passed. Religious services are considered an essential activity, but those attending in-person services are urged to provide at least 6 feet of space between others. While the safer at-home order is in place, you cannot visit friends or family unless you are their care provider, or leave the house for non-essential trips or gathering groups larger than 10. We encourage you to visit hcflgov.net/staysafe for up-to-date information.
The Florida Department of Health wants you to protect your family and friends from COVID-19. We are all at risk of transmitting the coronavirus to someone who may not be able to recover if they get it. It's important to understand that people who are older and those with medical conditions such as blood disorders, chronic kidney or liver disease, have a compromised immune system, a current or recent pregnancy, heart disease, lung disease, or a neurological condition are at highest risk for a bad outcome. Please visit floridahealth.gov and the CDC websites to stay informed.
Hillsborough County has issued a safer at-home order to help prevent the further spread of COVID-19. This applies to all residents and businesses within Hillsborough County, including the cities of Plant City, Tampa, and Temple Terrace. Essential businesses that have been identified by the U.S. Department of Homeland Security are allowed to stay open, some of which include grocery stores, restaurant delivery and drive-thrus, airlines, taxis, and other private transportation providers, and gas stations. These businesses are required to have employees telecommute if possible, but may continue to do essential work that cannot be performed at home. They are required to provide employment opportunities to those who lost jobs because of COVID-19. Non-essential businesses can stay open if employees can work from home, and they will be able to provide delivery services. Non-essential businesses must close if unable to meet the required guidelines. We encourage you to visit hcflgov.net/staysafe for up-to-date information.
A lot of things have been canceled, a lot of things have been postponed, but definitely not kindness. And we want to spread the kindness in our community and know that our first responders are still here for you. And thank you for staying at home for us, and we are here for you. So today we are here to surprise a little boy who is turning 9. He just moved to the county with his family and is very quiet, very shy, but has an affinity for fire trucks. And so what better way to welcome him to Hillsborough County and also maybe celebrate a little bit of his birthday by bringing one of our very own fire engines and a rescue to do a little drive-by, especially during this time.
We hear someone's having a birthday here. Is someone having a birthday here? Happy birthday, Kristen.
Hillsborough County leaders and local health experts want to get a clearer picture on how many residents may currently have the COVID-19 coronavirus. To help those efforts, testing criteria has been expanded. Now, any resident wishing to be tested for COVID-19 can call 813-272-5900 weekdays between 8 a.m. and 5 p.m. to request an appointment. You do not need to be experiencing COVID-19 symptoms to receive a test, but the Centers for Disease Control and Prevention has added 6 new symptoms to its existing list. COVID-19 symptoms include fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. If you develop any emergency warning signs for COVID-19, such as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to get up after sleeping, or bluish lips or face, you should seek medical attention immediately. Call 911 if you have a medical emergency. Notify the operator that you have or think you might have COVID-19. If possible, put on a cloth face covering before medical help arrives. We encourage you to visit hcflgov.net/stay safe for up-to-date information. Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, cough,
Good afternoon, everyone. I'd like to call the Hillsborough County Emergency Policy Group meeting to order. Would the clerk please call the roll?
Miller,
Here.
Overman,
Here.
Merman,
Here.
Cronister,
Here.
Castor,
Here.
Ross, Lott,
Here.
Isley,
Here.
Merrill.
Here.
All right, thank you. You have quorum.
Thank you very much. We're moving to public comment. We have 10 speakers this afternoon, I'm sorry. And each speaker has 2 minutes to address the body. The first speaker is Bruce Bohan.
Good afternoon, all. Thank you for allowing me this opportunity to speak. I'm the owner of Fishhawk Sporting Goods, a family-run store in Riverview, Florida. We are a baseball and specialty store with an emphasis on youth team sports. The COVID shutdown of Hillsborough County baseball and softball fields has cut our sales by 95%. We managed to survive by selling some items, baseball, softball, nets, through local media posts with local delivery. However, my business cannot survive and will not survive like this. I'd like to see the EPG prepare a plan to reopen the fields as soon as possible. The opening of local fields for baseball, softball, soccer, lacrosse, and football to organized leagues is very important, not only to us at Fishhawk Sporting Goods, but to the hundreds of thousands of young people and their families in this community, both from a mental and a physical aspect. These are children that have not seen friends, teachers, teammates, coaches in over 40 days. They have had so much taken away from them this year. Let's try to make life somewhat normal again. The opening of the fields is a great place to start. The fields can and should be open with a simple safety guidelines in place. Evidence suggests that the younger people have the least risk to the virus. In addition, games and practices are held outside in the fresh air, which makes organized sports a much lower risk.
Mr. Bohan, your 2 minutes are up.
In Little
Thank
League,
you. Mr. Bowen, your 2 minutes are, your 2 minutes are up.
He still has 20 seconds.
Okay. Do you have 20 seconds? Go ahead, sir.
Well, what I'm trying to say with the guidance of the EPG here, we should allow the fields to be open. And I mean, this is very important, not only to the kids, to get life somewhat normal again. That's what the emphasis of my whole call is here for. So I'm just asking that you guys move forward, provide the guidance as needed, and we can get the fields and get the kids out there playing again. And that's what we need.
Thank you.
Thank you.
Thank you, sir. Thank you. Janet Nguyen.
Hello, this is Janet Nguyen from the Tampa Bay Young Republicans. Yesterday, the governor stated many facts about how low the number of COVID-19 cases has been in Hillsborough County. Included in his statement was phase 1 of a plan to start reopening Florida. There are many small businesses that may not have had to close permanently yet, however, are days from having to do so if they're not allowed to reopen. There are many people with illnesses and health conditions other than COVID-19 who deserve the right to see a health professional. If we continue to keep medical facilities closed, we're going to start to see more deaths from lack of medical help and from the virus. Additionally, at this point in time, parks and beaches are essential to our physical and mental health. If it's going to be a while before life is completely back to normal, it's important to allow people to have somewhere to go for recreation. At least begin by opening back up our parks and beaches. Trust the people to be responsible for our own health and actions. We're capable of washing our hands often and staying 6 feet away from each other. We're requesting a vote on a reopening plan today, since Monday is 2 business days from now and time is of the essence. Thank you for your service on the commission and for your time.
Christopher Verkulen.
This is Christopher Verkulen. Good afternoon, EPG. Again this week, my fellow citizens and I comment on this meeting without an agenda, and before we have a chance to hear the actions the group is proposing. We don't call in to hear ourselves talk. We're here to communicate to our elected officials on how the policies they propose to affect our lives and provide a perspective that may not have been considered. We would also appreciate our statements being taken into account during discussion. The curfew debacle could have been avoided if this would have been taken into account weeks ago. To compound on what an earlier caller said, we need to allow people to return to being able to conduct their lives. It's a matter of financial stability and mental and physical health. And this is aimed at you, Mayor Castor. Placing and maintaining restrictions on activities that are entirely safe, especially keeping parks and recreational facilities closed because it would be difficult to enforce social distancing otherwise, is not a proper principle of governance. This is not Minority Report. We don't punish future crimes. Lastly, the group needs to evaluate how it classifies risky or dangerous behavior. We've seen the lethality and reported potential fall dramatically short of projections in the last few weeks. We need to start acting like it. I'll say it again. The average Tampa resident comes in contact with 2 to 3 people on their commute to work, and the average New York City resident comes in contact with 600. We've never had the elements for a spread like theirs, and that should have been taken into account from the start. Our goal has always been to keep the hospital system from being overwhelmed, not to eliminate the virus, not to keep infection count as low as possible. Those are not realistic. Any measure that exceeds that goal is a waste of potential productivity and encroachment on the freedom of your citizens. Thank you for your time.
Tina Eloan.
Hello, can you hear me?
Yes, ma'am.
Hi, this is Tina Maria Loyan, and I am the owner-broker of Florida Commercial Group here in Tampa, Florida. I own a boutique real estate company that influences Tampa Bay as well as Ybor City. I've been told from fellow citizens to please encourage the city to lift the restrictions on the city grant so that restaurants can qualify, remove stipulations of 5 employees or less, and lift the income maximum on this funding. It was not written correctly and has inadvertently hurt small business owners. People want to go back to work and go back now. In my regards, I've actually been working from day one. I put stipulations in place here where we're all very conscious of staying safe, keeping clean, keeping our environment clean. And I think that others have the right to police their businesses themselves. I feel that myself and others feel that our rights have been taken away from us. And it's just not good for the whole to take away your rights and have no, we have no idea when we're going to be open. Small businesses were inadvertently affected because many were not in the first rounds of the PPP loans. And then when they're offered to them now, many of those that are getting unemployment, it's getting a lot more money. So therefore, it's not helping the small business owner at all. And many of them are not even going to be able to reopen. So we're asking that you please lift this immediately and allow us to open up, police it ourselves. Now, Ybor City is a whole nother entity, and many of the communities around Tampa are in their own entity. So we need you to help us round up our leaders of those communities, especially in Ybor City, where people do come together in large crowds. We need you to help us with how we need to police it, how we need to have point of entries. Can we bring the restaurants out into the 7th Avenue, let people sit down and enjoy the camaraderie among each other?
Ma'am, your 2 minutes are up, ma'am. Ma'am, your 2 minutes are up. Thank you.
Thank you.
Kathleen Thomas.
Good afternoon. My name is Caitlin Thomas. I'd like to ask 2 questions today. First, the EPG is asking for public comments for the first 20 minutes, but is not giving feedback to those of the community they serve. We would like our comments not only to be heard, but to be addressed. Secondly, this question is specifically to the medical staff on the EPG. What is the known protection level factor of homemade masks? If that information is not known and offered to the public, how is it substantive that Hillsborough County officials recommend people to wear homemade masks and private institutions mandate people to wear homemade masks that offer no validated form of protection? I have found research that states cloth masks are not engineered to filter virus-sized particulates or prevent moisture retention. This data concluded that wearing cloth masks opposed to a surgical mask is shown to increase risk of infection. If homemade masks are going to continue to be recommended, what type of training is offered to the community you serve to properly wear the mask and its use? Without proper training, how are you ensuring families understand mask capabilities and parents understand that masks are not intended for young children, in addition to those with breathing issues or other compromising medical issues, even those with facial hair or disfigurement? Most wearers do not know how to properly don and doff a mask. Most wearers do not understand proper practices to avoid mask contamination. Homemade masks are made from unknown types of fabric that do not have a validated protection value. Please note my questions are to bring light to the accuracy of ensuring safety and health for our community members. I personally ask that our government officials commit to the health and safety of all of our community members to do their due diligence, not to share misinformation or misleading information. I personally want everyone to stay safe, stay healthy, seek expertise from subject matter experts. Thank you.
Philip Reynolds.
Chairman Miller, this is Chris Lampy with the communications team. That was the last caller that was able to call in the allotted time.
I'm sorry, say that again.
That was the last caller that was able to call in before the cutoff time. Everybody else signed up was not able to call in.
Okay, very good. Thank you. Thank you. The 20 minutes are up. So we now move into public health update. Dr. Holt, good afternoon.
Yes, sir. This is Dr. Doug Holt, Florida Department of Health, Hillsborough County. I will review the latest epidemiology. Kevin Wagner will then also provide the more detail. And I will also update on those public health capabilities that were outlined on Monday that are needed as we reopen. Epidemiology-wise, the 14-day trajectory has decreased about 20% over the week prior to this one. Percent of positive testing has remained similar at 6%. While our testing numbers returning are flat, they do not reflect the recent increase of testing that has occurred over the last several days. We had 2 new deaths. We now have 23 reported of Hillsborough residents. The hospitals, there is a slight increase in the number of people in the hospital, most of them in the non-ICU population. We're making good progress on the 3 public health capabilities that we will use as we begin to reopen, as outlined by Governor DeSantis. The long-term care facility rapid response team is already having faculty doing the shadowing so they can develop a curriculum for their students and nurses that will join and be part of our team to respond to any case in a long-term care facility. Dean Peterson has identified 20 volunteers from the College of Public Health. We expect to begin training them, orient them, and begin to put them to work next week. And as noted, I think our testing has increased significantly. So with continuation as we improve and strengthen these efforts, we are becoming better prepared to meet all the needs to both identify and respond if we see a second wave. I'll stop there.
Okay. Thank you, Dr. Holt. Mayor Ross, you recognize.
Thank you, Chair Miller. First of all, I got off and I missed the roll call, but I've been back on since public comment.
Okay, sir.
So, Dr. Holt, can you tell us how many people are currently in the hospital, please?
I'm sorry, number in the hospital?
Yes, sir.
48.
Thank you.
Ms. Dudley, you recognize.
Thank you, Chair. And I apologize. I just wanted to ask a question or point out that I thought we had 20 minutes of public comment set aside, and that was only 10 minutes. Are we out of speakers?
No, I was going to get back to that after Dr. Holt finishes comments. I looked at my clock also, and that was 10 minutes. We set aside 20. Okay. I was going to go back to see if we can go back to those people and see if they're still on the phone, because we cut it off at 10 minutes, not 20 minutes. So as soon as Dr. Holt finishes, I'm going to go back and do that. Mayor Lott, you recognize.
Thank you, Mr. Chairman. Dr. Holt, thank you again for being here today with your report, your data, and so forth. I have a couple of questions for you, if you don't mind. Our governor laid out a plan yesterday, and it's obviously a phase 1 plan. And with you being our main resource from a medical standpoint to this EPG, my question for you is, do you support the phase-in plan that he shared yesterday at 5 p.m.?
I certainly do, sir.
Okay. And with that plan, you believe that we'll continue to stay in where we're at right now, where our medical facilities are not at risk of being overloaded. Is that true, sir?
What we're doing with the hospitals and in partnership with the College of Nursing is to ensure that. I certainly can't guarantee anything, but I can guarantee we will be ready, because we will identify our cases early. We will isolate and track down their contacts, and we will also respond rapidly to any cases in long-term care facilities, which right now represent the greatest threat to our hospitals.
So if we can expand on that a little bit. So one of the things I'm really intrigued with, and I think that we've done a really good job in our state with, is the trace data and so forth, where we can see where there's a potential rise in the numbers. When we said that potential rise in the number from that data, how would you go about, responding to that particular flare up in the community and putting it out?
Well, that's where we would utilize a mobile team or resources to go directly into that community, promote testing. With the increased lab or turnaround time being reduced, we're able to identify the positives and do exactly what we need to do, which is reach anyone they might have been exposed and do everything to prevent them from spreading it to anyone else. As I referred to it, I think in the past, break the chain of transmission.
Okay. So based on the numbers we have right now and based on the governor's recommendation and your recommendation for us to move forward with the governor's plan, you don't see any reason why we wouldn't support the governor's phase 1 plan. Is that correct?
I certainly fully support the plan, and I believe that we must move forward to reopen.
Okay. Thank you very much.
Mayor Castro, you recognize.
Thank you, sir. I don't know if this is a request or should be crafted as a motion, but I would like, instead of the reports that we get, just saying how many tests we've done, how many positive cases we have, that Dr. Holt presents every week the testing goals, which I think were laid out the other day at 2,250 a day. So with that goal, the number of tests that we are providing every single day, and either a weekly or daily report sent to us at the EPG. And then also the framework for the contact tracing, like exactly what that layout looks like, and then a report on how effective we've been at the contact tracing, because I'd have to disagree with Mayor Lott saying we've done a great job of that. As we ramp up the tests, as we heard, we're going to have the 200 individuals that are doing those contact tracing, and I think that that's imperative as well. And then next is to, again, have the syndromic surveillance system that Dr. Holt and USF have created, so that we're familiar with that, and then have a report too that is presented at the emergency room and the physician's offices, and then what is presented Hillsborough County USF survey that's been done. So we have the GIS mapping that will identify those hotspots that we can respond to. I too support the governor's reopening plan, but we have got to have the information, the data on the number of tests that we're giving, the number of positive tests, and most importantly, hotspots are, so that we can respond quickly to those. I don't want anyone to think that this is the end right here. We are going to have more positive cases as we open up. The goal is to be able to manage those and to be able to protect individuals that are at high risk. So, Dr. Holt, would you feel more comfortable with that as a motion or as a request to have those reports either sent out to the EPG members or the presentation, at least at our meetings, our public meetings?
I don't know if it's my decision, but I have always tried to be fully responsive and informative to any request, and I will certainly honor every one of those that I'm able to do. Some of them will require some contributions from others, particularly those that are collecting the test.
Do you feel that you're not getting that information right now from the testing sites in a timely manner?
No, I wouldn't say that. I just really have not been that focused. That's I have not. That's not been a responsibility that I have been assigned to lead on.
Okay. Okay. All right. Thank you, Chair. I can follow up with you, Dr. Holt, after the meeting. Thank you, Chair. That's all.
You're welcome. Commissioner Merman, you're recognized.
Thank you, Mr. Chair. I just want to ask Dr. Holt, did we test 300 tests this week, or do you know what the numbers are? Will Kevin have those in his presentation?
He usually does. Yes,
So
according to my, there's two questions, two answers, I guess. My answer is I know how many results that came back. Mr. Dudley should be able to tell you how many tests, at least from Raymond James. The missing element, I think we've talked about a lot, and any of our other publicly supported sites. The missing elements have always been sort of those that are done in the community, whether they're done in the hospitals or one of the private sectors. And Mr. Early and I have certainly engaged the leadership of those hospitals or healthcare systems, I should say, to work with us to receive that data, and they have been responsive.
They have. So is there a central repository now for everybody to report their testings and the positivity and all that? Is that kind of where we're headed?
That is the goal. We are we started with the survey, and we are now going to follow that up with additional meetings, and that would be our hope, and I believe it is our shared goal to work with them to achieve that. I can't tell you what that will require, but we'll certainly, that's our goal. I'll stop there.
Okay. I mean, I think the issue is we get the information about 300 tests a day. We want to get up to 2,200 tests a day. That we don't know how much is going on in the private sector, so we really don't know. And then we've got the positivity, negativity issue related to the tests. So I guess it'd be great if, again, data drives our decisions. If we have more information like what Mayor Castor was saying, it's going to make us feel a lot more comfortable, number one, when we have hotspots, and number two, when everything is fully open. Thank you.
Mayor Lott, you're recognized. Mayor Lott?
I thought I already took my hand down. I apologize.
Okay, all right. Mr. Merrill, you're recognized.
Yeah, just to follow up on that, Gene Early is working with all of the healthcare systems, and in particular with PGH, to build the database that you're looking for. So what we've been presenting to you so far at EPG meetings, does report what we know. And Kevin Wagner's reports show that. But when Gene does finish compiling it, I think it will be responsive to
awesome.
To both to all the requests that you've made.
Right, that's what we're looking for. Thank you.
Dr. Holt, was there anything further in your presentation?
No, other than turning it over to Kevin to do the more detailed epi.
Before we do that, we cut the public off at 10 minutes, and it should have been 20 minutes. And I don't know if any of them were still on the phone or not, on the line or not. Let me revert back to public comment. Is Philip Reynolds on the phone?
Chairman Miller, this is James Brewer.
Yes,
Communications received 10 submissions for public comment. 5 of those submissions have called in and spoke. Therefore, we received only 10 minutes of public comment. At this time, the remaining 5 speakers have not called in to present their public comment. We will keep the line open to receive their call, but at this time, the remaining 5 had not called in.
Okay, but we set aside 20 minutes and we only did 10. That's the point. So the other 5 would have been 10 more minutes, which is giving us 20, and we didn't get to those. So
correct, sir, because
we
they
might
did
not
not
be able to
call
get
in.
back to those people. So they did not call in, so that's why we cut it off at 10. Is that what you're saying?
That is correct, sir. The remaining 5 speakers did not call in or are not available to speak at this time.
Okay, very good. That's what I was trying to find out. All right, thank you very much. Emergency management update, Mr. Dudley.
Good afternoon.
Kevin Wagner. Wasn't Kevin Wagner going to give his report next?
No, Mr. Dudley's there.
Oh, okay.
All right, good afternoon. We continue to support home testing and operations at remote collection sites, Raymond James, Lee Davis, South Shore, and Plant City. We have over 9,800 collection kits on hand to support ongoing operations. We've tested over 6,300 to date between the 4 sites. And as of Wednesday, close of business yesterday, between the sites, we've had 1,267 collections. As of 11 a.m. this morning, we have 1,289 appointments scheduled for today through Friday. As of 11 a.m., we also have 748 appointments scheduled for the following week, and I'm sure we'll have more on the books by the end of the day once they close operations at 5. We continue to support the county quarantine and isolation sites. We have no guests at this time at the quarantine site, and we have 5 guests in the isolation site. We continue to also support logistics operations. We've submitted over 1,700 requests to the state. We have distributed more than 195,000 gloves, more than 475,000 masks, more than 38,000 face shields, and over 6,700 gowns to date. We also continue to support the donations management warehouse. As of today, we've received more than 18,000 masks through donations. Since our last week, Hillsborough County has received over 10,000 responses to our survey about COVID-19 testing. This concludes my update.
Are there any questions? I don't see any questions of Mr. Dudley at all. Thank you, Mr. Dudley. Mr. Wagner, Mr. Wagner, did you have a presentation?
Yes, Chairman, I do, sir.
I'm sorry. Go ahead. You recognize.
Thanks, sir. All right.
Mr. Wagner? Mr. Wagner? I think we lost Mr. Wagner.
Chairman, this is James. He did drop out of the session, sir.
Okay. All right. Well, we'll move on and let me know when he comes back.
Looks like
Now
he's
move to
joining
the-
currently.
Pardon?
It looked like he just rejoined currently.
Mr. Wagner, are you there?
Apologize for that. My system locked up.
Okay.
Let me go ahead and bring this back up. I apologize. You are seeing my presentation now, sir?
Yes, sir.
All right. Thank you, Mr. Chairman. Again, Kevin Wagner, business analyst for Healthcare Services Department. Alluding to the conversation earlier, and we agree with Mr. Merrill, staff has always tried to present all the data that we know. Through my presentation so far, we've talked about Florida, we've talked about Hillsborough County, as well as some of the demographics of Hillsborough County. That information is still being collected, but this one today is a little bit shorter, a little bit more concise, focusing on the positivity and negativity results outlined by Dr. Holt. From a high-level standpoint, to date, through 4/29, the test results that have been filtered back in is 19,742, which represents, all the ones that have come in so far. Of that, 18,600, a little bit above, have been negative, about 94%, and just under 6%, 1,100 of them have been positive. So again, from a macro level, the positivity negativity level is very well at a 94 and less than 6% level. Alluding to the conversation earlier about the daily test results and the daily new cases, this is what's being presented on this slide. The blue line indicates the number of test results that get filtered back in that are updated on the FDOH report per day. As you can see, we've had high of nearly 900 and as low as nearly 200. So again, there's a lot of variability in those test results, which goes back to the conversation of testing with the hospitals and the private labs and getting those results in quickly. But the trend line, as we showed, I think last week, is fairly flat. We want to get higher. We want to flatten or higher the line of the test results getting back in, being test issued and getting those results in quickly. Bottom line of that green or the red dotted line is the trend of that. That is the number of new cases, positive results per day that are reported for Hillsborough County. So again, there is variability. High of 51 in the last 2 weeks with the low of 7 or 8. I point to the tail end on the right side of that green line. The last 3 or 4 days, we've had 7, 14, 18, and 25. That's not a trend per se, but it's something that we will keep on watching because those are the cases that are getting positive and as they're returning in. But overall, the trend line for positive cases in Hillsborough County is slightly going down. But again, we don't have a lot of positive cases. This is over the last 2-week period. Now, as we've talked about positivity and negativity, there's been so much conversation of what's the trend. So what's presented here is the 7-day trends by week. Starting on the far left is 3/29 to 4/4. In that week, of all the test results, 90% came back negative, 10% came back positive. The following week, 94% were negative. The following week, 95%, and 97 and 96% is the current week. So again, the trending of the positivity and negativity results are key. The blue line is trending higher on negatives. That is what we want to see. The red line at the bottom is trending lower. That is what we want to see as well. So again, that's how we are looking at the 7-day macro level between the positive and negatives. When we step back even further, another layer down, we went 7-day. This is the 3-day represented. So again, you're seeing a little bit of, on the left side, an 86% was negative, 14% was positive. That was on April 1 to April 3 in that 3-day range. But again, looking at the tail end on the right side, we have 98%, 96%, 94% were negative as well. So by and large, the county has been mid-90s and higher at a negative rate. Again, that trending is higher in the direction that we want to see. And on the positive side, that is trending lower, which is what we want to see. This last week of the tail on this presentation is not being completed yet, so we'll see where we finalize in the last week. We've done 7-day, we've done 3-day. This is the daily. So again, no little bumps overall. Mid-90s and the upper 90s. You see a positive trend with everything presented on the data by each day. So again, yesterday was 93%. The previous day was 96 and 97 and 99%. So again, we are looking for the testing, getting the results in quicker, and having a continued high negative result for the trending in the results that are received. When we talk about testing, the very first slide of this was 19,000 tests that have been reported, equates to about 1.34% of the population. I know there's been a number of conversations about trying to get to 2% higher. This is where we stand right now, based upon the results that have been received to FDOH. Not the number of tests issued, but the results have received. About 1.34% population tested, and the other 98% has not been tested. And again, I can't account for individuals who get more than one test. And that's all I have. If there's any questions, I'll stop there.
Thank you, Mr. Wagner. I don't see any questions, sir. So thank you very much for your presentation. We'll now move into the county attorney's update. Ms. Beck.
Yes, good afternoon, EPG board members, Chairman Miller and Chairman Miller. This is Christine Beck, the county attorney. And in your backup materials, you received 3 documents. These were released last night by Governor DeSantis. The first document was the plan for reopening and guiding principles. The second was Executive Order 20-111, and the third was Executive Order 20-112, as well as new FAQs to go along with understanding that order. I will focus on the orders and provide a brief summary of each of the orders. Order 20-111 extends the orders numbered 20-87, 20-91, and 20-92 until 12:01 a.m. on May 4th. The order 2087 was exclusively relating to not allowing vacation rentals, and so that order has been extended till May 4th. And then orders 2091 and 2092 have been the orders that we have been following since they were issued by the governor, and they set out the essential services and activities. You will recall that Order 2092 had the language that the governor's order supersedes conflicting local orders. Without the extensions contained in Order 20-111, the orders would have expired today. So this 20-111 essentially just carries you over until Monday. Order 20-112 is actually where most of the substance of the new actions by the state are reflected. And this order takes over as the controlling order in Florida, with the exception of Miami-Dade, Broward, and Palm Beach counties, and it becomes effective at 12:01 a.m. on May 4th. I would note that the new order from the governor, the 20-112, no longer includes language superseding conflicting local action or orders. 20-112 reinforces the principles that were set forth in the governor's prior orders relating to essential services and activities, and those all remain allowed, provided that CDC and OSHA guidelines are followed. And as to senior citizens and those with underlying health conditions, they are now strongly encouraged to stay home. And a few more general points under Order 2012. Local jurisdictions are to continue ensuring that groups greater than 10 are not permitted to congregate in public places if social distancing cannot be maintained. All persons should continue to avoid non-essential travel. All persons should adhere to CDC guidelines and travel restrictions. And orders, some other business that was taken care of, or 3 different orders were also extended. These relate to airport screening and travel-related issues. The most important parts, I think, for this group are set forth in sections 3 and 4 of the orders. And section 3 is new action taken by the state that addresses previously restricted businesses. And in section 3, bars, nightclubs, and pubs must remain closed. Restaurants may open if they adopt appropriate social distancing measures and if they limit their occupancy to no more than 25%. And in addition, outdoor seating is permitted, provided there is a 6-foot distance between parties, and parties can be no greater than 10. Gyms and fitness centers remain closed, and vacation rentals are still not permitted. Moving into section 4, which is titled as an affecting other businesses, this section provides that retail may open storefronts provided there's no more than 25% occupancy and social distancing is followed. And in addition, the governor allows museums and libraries to open at 25% occupancy. But this is only if it's permitted by the local jurisdiction. With regard to museums and libraries, interactive components, however, must remain closed. Section 5 is addressing medical issues, and this new order now allows for elective surgical procedures to resume. And surgical centers, dentists, orthodontists, endodontists may open and perform procedures under a listed set of conditions. And finally, in Section 6, the Order 112 extends Order 2069, and this is the order that permitted virtual meetings such as the one we're having today, and that order has also been extended. So with that summary, I'll be happy to address any questions.
The order that the governor, the executive order that takes effect Monday morning at 12:01, that's 20-112?
Correct.
Okay, the order that he put forth that was a safe at home, that does not expire until 12:01 Monday morning?
Correct, because of Order 111 actually extended it just to carry it forward so that there would be coverage through the weekend.
Through the weekend, okay. So 2011 extended the safer at home until 12:01 Monday morning. And then after 12:01 Monday morning, 20-112, which is the one he talked about yesterday, goes into effect.
Correct.
Okay, all right. Ms. Snider, you recognize?
Thank you. Yes, thank you so much, Chair. So over the last several days and weeks, we've had the opportunity to review a lot of data provided to us by obviously many public health officials, a team of experts. Some of us have also been researching financial experts who are forecasting, the impact of what this pandemic is going to have and continue to have on our local and state and national economy. We've also received a lot of communication from our constituents who all of us represent, and we want to make sure that we let everyone know that we are listening to the feedback that we're getting from the citizens of the county. So in light of the governor's announcement and the execution of a new order at 12:01 on May the 4th, I think that we need to, as the EPG, take some action today and maybe make some decisions which help to reopen our communities as well as our local economy. There's been a lot of confusion about some of the orders. I know there was a recent order that was extended by the county that just was for county buildings and locations under the administration of the BOCC. I think we need to offer some clarity and some consistency and some continuity in whatever we decide today. So with that, I wanted to ask Ms. Beck for her advice as counsel on perhaps 2 different scenarios that we could consider today. One would be to rescind our current safer at home order and allow the obviously the governor's order that takes effect at 12:01 on May 4th to take obviously to take effect. That's what we would have to be under that order as a state order. Or would it be wise to continue the safer at home order until 12 a.m. Monday morning and until the governor's order takes effect at 12:01 a.m. What would offer the most consistency and clarity for our community? Could you kind of give us your advice on perhaps those two different scenarios?
Yes, Ms. Snively. If the EPG board was interested in rescinding our local Safer at Home, which, as we know, we were following the governor's order anyways, but that order was out there. If you wanted to rescind that for clarity purposes, my best advice, I think, would be to have it be effective concurrently with when Order 112 takes over, which would be at 12:01 a.m. on May 4th.
Okay. And just to clarify some of the reasoning for our current order to be in place and stay in place, because I know that there could be some potential financial ramifications to our county if we don't have an emergency order in place. Is that am I understanding that correctly? Is that one of the benefits of keeping the order in place is for financial relief to our county, having that emergency order in place?
So the Safer at Home order doesn't have a relation to that, but just having our local state of emergency order in place might. That would be something I would recommend that we have staff comment upon. I have heard from various emergency management personnel that having an emergency order in place facilitates work that is done to obtain FEMA reimbursements and so forth. So that's my only comment with regard to having a local state of emergency order. But there would not be the same concern with the Safer at Home order.
Okay.
This is Tim Dudley.
Pardon me?
This is Tim Dudley.
Who is this?
Tim Dudley.
Mr. Dudley, you want to say something?
Yes, in response to that local state of emergency, I just wanted to remind the EPG that that is correct. We do still currently have ongoing operations at Q&I sites, the collection sites. This LSC helps us to remain agile to make those emergency purchases as required to continue supporting emergency operations.
Okay.
Thank you. And so may I respond to Ms. Beck on that as well, Chair?
Yes, go ahead. You still have the floor.
Thank you so much. So the emergency order would need to stay in place. And your recommendation, if I just to be clear, would be to only extend the current order through Monday at midnight, where then at 12, and then let it expire. So we could vote to let that expire at midnight, and then the governor's order would take place at 12:01. So if that is correct, then I would move to extend the order and let it expire. Yes.
Yeah, maybe just to be clear, I want to make sure we're talking about each order separately. The order that we have been renewing every 7 days, I'll just refer to that as the order, continuing the declaration of the local state of emergency. And I think that's what Mr. Dudley was referring to, that allows for emergency purchases and a lot of the benefits that you have. And so as I was hearing him, I think the recommendation would be to keep the local state of emergency order in place. And that one is due today to be, is up again today, will expire today if it's not extended. So that's that issue. With regard to the local Safer at Home order, we did not put a ending date in that order. It didn't have it didn't expire at any particular time. And so that's why I said that if you believe that it would be less confusing to the public to just be operating under the governor's order and not have our order in the mix, you could rescind that order. And again, for clarity purposes, it might be best to just have it be effective as of 12:01 a.m. on May 4th.
Okay, so to rescind the safer at home order at 12:01 when the governor's order takes effect.
Yes.
Okay, so Chair, if I may make the motion to do that, if you would entertain that motion, that's what I would recommend for us to do today, is to only extend the safer at order. Only extend the safer at order until the governor's order.
Safer home order.
So, thank you, safer home order. Sorry, until the governor's order takes effect.
Okay. All right. There's a motion. There's a motion by.
I'll second.
Ms. Snively, is there a second?
There's a second.
Oh.
Okay. Now make one thing perfectly clear. Okay, I got it. To make things perfectly clear with her motion is to extend the safer at home order until 12 midnight Monday. And that's when at 12:01 the governor's new order comes effective. People have gotten confused because the press got it messed up. This does not pertain to the May 15th order that was set out by Mr. Merrill that says that county buildings will remain closed and employees who are working home remotely will continue to work remotely. So I want to make that perfectly clear because it was all messed up by the press this week. So are we understanding that? Okay. Commissioner Merman, you recognize.
Thank you, Mr. Chair. Yeah, I was actually, Ms. Snively said a lot of the points I wanted to make. I think the major point is, and the public probably doesn't know this, the governor's safer at home order expires today. And that's why, is that correct, Ms. Beck?
It does expire today. However, Order 111 extended it until Monday. So the idea would be that that the governor's order is in place until Monday, but then Order 112 takes over.
So then why do we need to extend the county safer at home order if basically they're the same? Why would we need to do that?
Yeah, you wouldn't need to extend it. I thought the question was whether we wanted to rescind it.
Rescind
the safer at home and just have it be very clear that we're operating under the governor's order.
We always, and for the listening public, we have always been operating under the governor's orders. Always. There's no order.
This is where we get people confused.
It does. Absolutely.
This is where we get people confused.
I'm confused by Ms. Snively's motion now because I think we should just rescind the county order today and just stay under the governor's orders, and then his new one will take effect on Monday at 12:01 a.m.
May I respond? Sure.
Okay.
I think that's what Ms. Snively wants to do.
Well, and I was trying to get from, and correct me, Ms. Beck, if I'm wrong, maybe I misunderstood, but I was trying to do what would be the least confusing. And so since the governor extended his order until Monday, I thought we could do the same thing in alignment with what he was doing. I understand the duplicity, and I know it's redundant, but we've been working under these both orders at the same time anyway. So really just out of some continuity, I was just making the motion to extend it in alignment with what the governor's doing with extending his own safer at home order until his other order picks up at 12:01. So just trying to be, simplify the process, that's all. But thank you.
So I guess you're picking the least confusing motion for the public. But I can tell you honestly, they're completely confused when our county order stays in place. That's what I think. So I'll wait and hear from the other members.
Commissioner Merman, if we rescind our order today and the governor's order stays in place, I think there'll be even more confusion. If we just continue our order like the motion says until 12 midnight Monday, and then the governor's 20-112 order comes into place, I think that's the least confusion what we would have. I think if we now said we're going to rescind the county's order and the governor order stays in place, there's going to be a lot of confusion. That's the way I see it. Maybe I'm wrong. Go ahead, Commissioner Berman.
Okay, well, let's listen to other people, but I'm fine. I am whatever way we go, but I got to tell you, these emails that we're getting, hundreds of them every day about please rescind the county order, people are very, very confused. So I think they think our order is more restrictive than the governor's order, which it is not. And I'm trying to remove or figure out how can we remove that confusion of our county order and the governor's order, because they're never always been the same.
If the press would emphasize what we're saying and get it right, I think then we would not have this confusion, just like we had this week when Mr. Merrill said
good point.
The county government and employees would stay home through May 15th. Okay?
Good point.
Mel, you recognize.
I hear.
I definitely support this motion and the second on it. I would be okay with rescinding the vote today because our order doesn't have any, power or authority over the governor's current order. But I also support, the idea of us allowing it to run out at midnight with the governors. That way, if this body feels comfortable with it, I think it gives us all the opportunity to have one voice and come out with one voice. That the current order that's in place right now is null and void as of midnight Monday night. And so I'll definitely support this motion. Thank you.
Thank you. Commissioner Overman, you recognize.
Thank you, Chair. I'll make this quick. Ms. Beck, could you go over the governor's order for Section 2 regarding responsible individual activities and what things will go into place with the governor's order? It specifically indicates that all persons in Florida shall continue to limit their personal interactions outside of their home. However, as of effective of this order, persons shall provide or attain all services that are currently allowed, and then it goes on. So when we talk about the citizens being confused, and we rescind our order, and we go to the governor's order, and we don't talk about Section 2 of the order, which still recommends people limit their personal activities out of their home with some exceptions. I think the press needs to understand that while we may move with this motion to the governor's orders, it still doesn't mean a lot of people aren't asked to stay at home to some extent. So, Ms. Beck, could you clarify that section for me and explain what that section is needed by our citizens to understand what they're permitted to do and not do? Thank you.
Which order are you speaking of, Commissioner Overman?
I'm reading the governor's order 112, and that's the one that goes into place at 12:01.
Okay.
Yes. Commissioner Overman, I will do my. I'm sorry. I will do my best to try to address that. The way I read Section 2 is that it continues with the provisions that were in the prior order 20-91 that put limitations on individual movements, and individuals were only authorized to go to either an essential service or an essential activity. And that's continuing to be allowed. And there's still the restrictions for strongly encouraging senior citizens and those with underlying health conditions to also stay home. The governor's order has always been premised on individuals as opposed to businesses. So that part of the order is consistent with his prior order, in my opinion. What this new order does, what 112 does, is opening up more of Florida, and it's allowing individuals to go to now restaurants and other places that previously may not have been permitted. I'm not sure if I answered your question, but I'll try again if I missed it.
I think it's just important to recognize that when the people here rescind our safer. I'm sorry. Am I recognized? I'm coming back to Christine Beck's response.
Yes, go ahead.
Okay. So I think it's important for people to hear that if we rescind our safer at home order and we adopt the governor's order, there's still some restrictions on actions. It's not, business as usual. So I think it's clear what the governor has responded to, and I think it's important that we are clear about what that recommendation for our citizens, how that stands. Because there are still some restrictions on actions that citizens, individuals, you are correct, need to follow in the recommendations associated with that. So thank you.
Mayor Ross, you recognize.
Thank you, Mr. Chair. Well, much of it has been said already. I support the motion, and I also support the idea of coinciding the timing with the governor's order. I think that makes a lot of sense. I'd love to rescind today, but that would just cause confusion. Everybody would want to say, well, Hillsborough's, business, and when in fact, we're really not. So it's a well-crafted motion. I support it, and I also support the timeline.
Mayor Castor, you recognize.
Thank you, sir. I was trying to figure out what the point of this conversation is. And it seems to me that the only difference, jurisdictions across the state have their own form of the safer at home. And the difference that I see is that in the governor's order for essential businesses, essential services, it says shall limit essential services, where ours says essential businesses must close. So that seems to be the only difference. For the life of me, I couldn't figure out why all this talk about our rescinding of the safer at home, when plenty of jurisdictions have it along with the state. And in the governor's FAQs that are attached to the order 20-112, it says, or the question presented, are local authorities allowed to adopt requirements directly on businesses, operations, or venues, including buildings, beaches, and parks, that may be stricter than the governor's executive order? And the governor's answer is yes. So is that, I would ask Ms. Snively or Mayor Lott, is that the point, the end game of rescinding this?
Who do you want to answer the question, Mayor?
Either one of us can answer that, I think. So I think the point in rescinding this is to create some alignment with what the governor's orders will be, have been, are, and will be. And I don't know that we need to continue our safer at home order if the governor is not continuing a safer at home order. So it's really just to be consistent with what the governor's orders are going to look like. So other than that, and obviously with his order that begins, it is imperative, I think, that we continue to focus on how we can reopen our community in Hillsborough County, and that's exactly what it does. If we don't rescind the order effective at 12:01 and it continues, then we are certainly operating in a much stricter environment than the governor is allowing. And I've heard from my constituents day after day, and email and phone call, is they want us to loosen up and they want us to reopen. And that is exactly what the intent of the governor's order 2112 does, is allows us to begin to phase in a reopening of our local community and our economy. And so really, it's to streamline what we're doing today, have some alignment with the orders, and then follow the governor's plan. We don't necessarily have to move to make a motion or vote on adopting his plan because it automatically takes place. So really, this motion is just to rescind the current safer at home order at 12:01 when the governor's new order 2112 takes place. Thank you.
Castro, you have anything else?
Chairman, can I answer?
I agree that, we all want to follow, we're all in agreement. Oh, did you recognize me, Chairman?
No, go ahead. You recognize, go ahead. Yeah, go ahead.
We're all in agreement, I believe, as a group in supporting the governor's reopening. I just clearly don't understand all of the discussion about this when they're not in conflict in this conversation. We've spent so much time on this conversation that started before the governor even put an order out. So it was just perplexing to me. I just thought there had to be some kind of a logic to it that was lost on me. Thank you.
Mayor Lott, you recognize.
Thank you. Mayor Castro, I appreciate the opportunity to answer your question. I agree with school member Mrs. Snively on her motion and her rationale behind it. I don't want to repeat it, but the other thing I want to add is I don't see the purpose of having basically a redundant order. I think when you have an order on top of an order, that's where confusion comes from. And either we're going to get behind the governor's leadership and his order, or we're not. And I think that's really the question and what this vote is about today. Is we've already been under his the current order that we're in place right now. With a redundant order sitting behind it. And as our governor starts opening up other phases, if we still have this order in place, then the question comes, are we a part of phase 2, phase 3, whatever phases he may have in front of him? Do we go forward? Do we move backwards as data comes out? Because he says he's making a decision based on data, not based on fear. And so I think we just need to clear the message here. And either today's vote is either we're behind the governor's order or we're not. If we leave an order in place, that means we're still sitting here wanting to possibly conflict with it, possibly put our order in competition with his order. And if that's the desire, we can do that anytime down the road. But right now, I say let's clear the road, let's clear the path. And he played out a very good plan yesterday that we're all so far saying we're behind it. So I don't know why we'd have something that would be redundant and in competition with him. So that's the rationale behind my reason for supporting this. And thanks for the opportunity to speak. Thank you.
Mayor Ross, you recognize.
I'm sorry, Mr. Chair. I forgot to take it down.
Okay. All right. Thank you. Commissioner Overman, you recognize.
Thank you. So if we rescind this order whenever we do, Monday or today, what happens if our numbers spike differently than the trend of the entire state of Florida? How and when do we act, and what do we do if we have no concurrent order that runs alongside of the governor that isn't in conflict at this point? And I don't know who to ask that question or answer it.
Ms. Beck, Ms. Beck.
Yes, I'll be happy to address that. The mayor raised a good point in the FAQs that it's very clear that under the new Order 112, and frankly, this was also part of the FAQs under Order 2091, that local authorities can adopt requirements directly on businesses, operations, or venues, including buildings, beaches, and parks that may be stricter than the governor's order. So there is that ability as we go forward. If our numbers were to cause a reason to want to take another look or put in stricter measures, I think we would have the latitude to do that under many circumstances. We cannot alter what are deemed essential services or essential activities, but I think we have opportunities under this language to address things that may be a concern. So there is that provision, and as I mentioned, there's no longer the language in the order that says that the governor's order supersedes local orders. So I think that we would have latitude to take action to protect our community.
Commissioner Merman, you recognize.
Thank you. Thank you, Mr. Chair. Yeah, and I think that's the purpose of the emergency policy group, is to act in emergencies. And if the numbers do spike again, obviously we would act accordingly, just like we do. We have to act very quick when hurricanes come here, or they take a turn and they're headed for us rather than going a different direction. So I've always felt, and I think we would work with the governor's office and make sure that we have his support going forward if we had to initiate any stricter type actions that would help keep our community safe, and like the mayor has always said, to save lives. But I think the governor's got us off to a great start, and we're finally going to attempt to get back to normal, at least 25%, get our economic machine moving again, get people back on their feet and get them back to their jobs. And that's what I'm concerned about, and hopefully we can just move forward after this vote today.
Mr. Nobby, you recognize. Ms. Nobby?
Oh, sorry. Yes, I'd like to call the question, please.
Well, you're not going to let me comment. Okay. Question has been called.
Oh, I'm so sorry. I apologize, Chair.
That's okay. No problem. No problem. No. Rules are the rules.
You are the chair. You may. No. I will withdraw.
No. Rules are the rules. Rules are the rules. Rules are the rules. You can't withdraw a question. So we have a motion on the floor by Ms. Snively, second by Mr. Merman. Commissioner Merman, please call the roll.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Cronister?
Yes. Say yes. I'll say no.
Castor?
No, I see no purpose in this.
I'm sorry, what did you say?
I said I vote no. I said I don't see a purpose, so that we can tighten up, leave the order in place, and then tighten up if necessary.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
Motion carried 7-1. Mayor Castor voted no.
Thank you. Ms. Beck, you still have the floor.
Yes, Commissioner Miller, the only remaining item is with regard to the 7-day extension of the local state of emergency. And that is up to the board whether they would like to extend that.
Okay. Any comments on that? The local state of emergency? And I think that didn't Mr. Dudley explain why we needed to have that? Am I correct?
Yes, you are. In order to keep our emergency purchases and so forth, it provides that benefit as well as others.
I'll move to
Commissioner Overman moves to extend the order, please.
Okay, we have a motion by Commissioner Overman.
Oh,
is there a second?
I did. I'll second. Commissioner Merman.
Motion by Commissioner Overman, second by Commissioner Merman. Mr. Merrill, did I see your hand?
Yeah, I think we're okay. I wanted to make sure everyone understands that you all have a lot to lose financially if you don't approve this, because this is the only way we recover federal dollars. So I just want to make sure everyone understands that before they vote.
Okay. Commissioner Merman, you recognized.
No, that's what Mr. Merrill said exactly what, and he's more of authority on this than I am. But no, we have a lot to lose if we don't do this.
Okay. Seeing no further hands, please call, I'm sorry, Mayor Ross, you recognize.
Thank you, Chair. I just wanted to point out that the emergency order, as it's drafted, that we have in the backup material, incorporates the safer at home order and all the other previous orders in it. So the language of that, if I'm not mistaken, Ms. Beck, would need to be revised. What we would be passing would not be the draft that we've received. Is that correct?
Yes, that's an excellent point, Mayor Ross, and we would certainly make that revision to the document to be in accord with the votes recorded today.
Okay. In that case, I'm going to ask Commissioner Ullman to withdraw her motion and Commissioner Merman to withdraw her second, and have Ms. Ullman state another motion incorporating what Ms. Beck just said that came from Mayor Ross. Am I making myself clear on that?
Yes, sir.
So would you make another motion, please?
I'm
Withdraw
going
your,
to,
withdraw your first, so you withdraw your other motion.
understood. I withdraw the previous motion.
Okay.
And Merman, do you withdraw yours too?
I withdraw. Mm-hmm.
All right, so I'll change the motion or submit another motion to approve the extension of our emergency order. We're taking into consideration today's vote regarding the order and the safe at home to begin immediately today.
Okay.
I'll second. I like a little bit different order.
I'm sorry, say that again?
I will second the motion, but I'd like to have it be worded differently, where it didn't just say it reflected the vote, that actually we eliminated the safer at home order.
Okay. There's a motion by Commissioner Merman, I'm sorry, by Commissioner Ullman, second by Commissioner Merman, and I think the staff will be able to clean up.
Okay, I do too.
Okay? All right. They'll clean it up. Seeing no hands at this time, please call the roll.
Miller,
Yes.
Overman,
Yes.
Yeah.
Merman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Lott,
Yes.
Snively.
Yes.
Motion carried 8-0.
Okay, thank you. Ms. Beck, is there anything else you want to bring forth?
No, sir.
Okay. Moving to EPG discussions. Is there anything that members of the EPG like to discuss at this point in time? Ms. Snively, you recognize.
Thank you, Chair. Could we get a little bit of clarification on what exactly is happening with our parks and beaches and ELAPs? And we've gotten a lot of constituent feedback, at least I have gotten a lot of constituent feedback about opening up some of our parks and some of our recreational areas in the county. And so I think there's a lot of confusion about what's open, what's not open, what the county has closed, what we have the authority to do, the individual municipalities. I know that I remember Mr. Merrill saying that there were some issues with some of the parks and some bad behavior, bad choices that people were making, some issues. But, you know, in lots of areas, especially in the more rural parts of the county, there are a lot of parks and a lot of ELAPs and places where people are easily able to recreate and maintain, you know, their social distance. And so I would love it if you could, or someone could explain what exactly is happening with the parks, and is there any opportunity for us to open up some of the parks? And I think that a few of the parks, if they're having some issues, should not make the rest of the parks unable to open if the majority of people can social distance and enjoy and recreate So just wanted to open up that discussion. Thank you.
Okay, before I call on Mr. Merrill and call on Mayor Castro to talk about the city parks and Mayor Parks, to talk about his city parks, and Mayor Ross to talk about his city parks, do understand that this body has no control over parks and trails and beaches at all. But Mr. Merrill has something he's going to talk about today that he's going to present, I think, later on. So, Mr. Merrill, you recognize.
Yes, Mr. Chair. I've got a document I'm sharing here, if we can pull that up. I don't know if you can see it. Okay.
Yeah, it's up.
This is a press release that went out, or media release that went out today. And as you can see, it indicates a two-stage opening. On Saturday, we're opening at 8 a.m. E.G. Simmons Conservation Park and the boat ramp. And then 8 a.m. Monday, we have these 4 openings here. So those are the ones that are currently affected. I was waiting until we had the governor's reopening order in place so that when we did open, we were not going to be in conflict with the governor's order. And so that's why this is being done today. And, as we move forward and can apply, additional openings, we will. But this is the initial opening.
Thank you, Mr. Merrill. Mayor Castor?
Yes, we will be coming out with a release tomorrow. Right now, we have 6 exercise trails that are open and have been open in the city of Tampa, and we have 4 boat ramps.
Okay, thank you, ma'am.
Thank you.
Thank you, Mr. Chairman. Yes, currently and since the beginning of this pandemic, all of our trails have been open. All of our passive parks have been opening. And next week, we'll have all our parks open in Plant City, and we'll be announcing that day on Monday on the grand opening of the rest of our parks in Plant City. Thank you.
Thank you. Mayor Ross.
Thank you, Mr. Chair. Our parks and boat ramps are all open. We have fenced off our playground equipment for obvious reasons, but the parks themselves have been open and the boat ramps are open.
Okay. Ms. Dudley, did that answer your questions? A question?
Oh, yes, that's very helpful. Thank you so much for all of that information. I think that people will be pleased to see us, see the counties and municipalities phasing in some of the more of the opportunities to recreate in different parts of the county.
All right. Okay. Is there any other discussion from members of the EPG?
Oh, I have my hand up.
Commissioner Merman, you recognize.
Thank you. And I do want to thank Mr. Merrill and the staff, the Parks and Rec staff. They did their due diligence and work. And I think to slowly phase this in is appropriate, kind of matches what the governor is doing. And we'll just see how things go. And hopefully the public will adhere to social distancing, not congregate, keep their groups to 10 or fewer. Mr. Merrill, will there be signage? There will be signage along the ways at the parks.
Yeah, there will be Oops, sorry. There will be signage, and there will also be sheriff's patrols and others there to enforce.
Great. Thank you very much.
Okay. Commissioner Overman, you recognize.
Thank you, Chair. I just have a real quick question. In our orders, as well as the governor's orders, there's some guidance on daycares. And if many of our businesses that are able to open under the new phase 1 procedures, there are some strict guidelines on how daycares open. And that's one item. And then 2, what happens to the single mom that has to go back to work now that may or may not have access to daycare, since our daycares are being told they are to reserve space for our essential personnel? So I'm curious about what guidance we give our daycares that have not been able to operate. They're very strict guidelines on how they can operate. So I'm just curious, do we have guidance for the daycare business now that the schools are closed and people have in those essential services or businesses that are now asked to open up? What happens to that worker when they may or may not have access to daycare?
Who wants to answer that question?
I can possibly help, Commissioner Merman. As a member of the Early Learning Coalition, I know they've been working hard with the Children's Board, with Angela Channing, who runs our child care licensing at Hillsborough County. There is monies available to provide free daycare to, excuse me, first responders and healthcare workers, essential workers, more or less. But also they're getting ready to open up and help fund the opening of many of the child care centers. And so I guess what I'd like, and maybe Mr. Merrill, you could direct Angela Channing in collaboration with the Early Learning Coalition to bring a report back to us next Monday on what's happening. But that's kind of an overview of what's going on. They are trying to get them open.
Did I answer a question, Commissioner Oben?
Yes, thank you.
Okay. Commissioner Merman, you recognize. Commissioner Merman, you recognize.
Oh, no, I meant to take my hand down.
Okay.
I think I did.
All right. So any other would like to any discussion from any other member? Discussion from any other member? Commissioner Merman, your hand's back up. You want to say back up something again?
There must be something wrong with it because it's going with it because it's definitely lowered on my computer. Sorry. It's
okay.
Down.
All right. Okay. All right. Well, seeing no further hands up today. Now, I want to wish everyone have a safe weekend. Take care of yourselves, and we'll be back here on Monday at 1:30. See no further discussion. We adjourn.
Mr. Chair.